Hi everyone, I am Dr. Christine Anderson, also known as Dr. Chris to my patients, and I am a pediatric chiropractor, so I'm board certified in pediatrics and pregnancy, as well as hold a fellowship in childhood developmental disorders, which uses functional neurology to help kids live optimally. So, no matter what's going on, whether there's no apparent symptoms your child has, or they're having mild difficulty, or even a lot of difficulty, there is something for everybody because I look at every individual child as a separate person, not just a collection of symptoms or a label. And this is why I am doing this series on primitive reflexes, because it is the foundation of brain development in every single human right after they are born. So, with this asymmetric tonic neck reflex, I'll abbreviate it sometimes as ATNR. It's also called the fencer reflex, and you can see there the baby in the picture has kind of an on guard position, and we'll talk about that. So, with the ATNR, you might have this occur with your child. They might have a retained reflex, and we're going to talk more about that in a second. If they've been diagnosed with things like dyslexia, ADHD, autism, or if they have social or emotional or behavioral challenges, poor memory, poor coordination, poor handwriting, poor eye focus, and other learning problems. So, a whole realm of things. But why would it be that a retained primitive reflexes can cause these things? Well, stay tuned. We're going to find out. While we're at it, why don't you just hit that like button right now? Give me a thumbs up and subscribe before you forget to do so that you get notified whenever I have a video. Typically I come on every Tuesday at 6:30, but sometimes I have videos that I put out just spontaneously. All right, so first of all, just to let you know, to start off this series, I did a video on the introduction to the neurologic reflexes. I highly recommend going back and watching that, as well as the primitive reflexes. This is an overview of what they are, how they help us to be born, survive, and develop our brain. I will put the link in the description after I finish this video, and I do recommend you go back and watch them for some background on what I'm going to talk about. Okay, so let's talk about the asymmetric tonic neck reflex. So when you turn a baby's head to the side, so in this instance on this picture, the baby's head is being turned to the right. And so on the right side, you're going to have the arm and the leg straighten out. And on the left side, the opposite side, the arm is bent and the leg is bent. This is the asymmetric tonic neck reflex. It is a primitive reflex, and you're going to find this right at birth because it develops at 18 weeks in utero, so quite early on, and it does help with the birth process. It's actually activated and reinforced by having a vaginal birth. So if you have a baby who's born with a C-section, we're going to talk about if you don't see this reflex, that may be one of the reasons. It is necessary for survival, so when a baby is face down, they're going to have this reflex turn their head so that they are not going to suffocate. It creates a pocket of air for them. And also, if they're going to fall, they're going to turn their head and the arm and leg are going to extend and hopefully break their fall a bit so that they just don't fall right on their face, on their head. It's also involved with vision development. There is the coordination of the hand and the eye, and we're going to talk more about that in a second. So what if your baby is born and you're checking to see if this reflex is present, and you can easily do that just by turning your baby's head to the side and just holding it there for a second. Now, if your baby does not want to turn their head to that side, so in other words, they're favoring one side over the other, it may mean that they have what we call in chiropractic a subluxation. A vertebra at the top of the neck might be out of place, or there might be some cranial restrictions. So they might favor turning their head to one side or the other. And if they're resisting turning their head to the other side, don't force it. Get them in to see a chiropractor who specializes in pediatrics and who also does craniosacral work, and get them checked out to make sure that they don't have a subluxation. And this is something I see quite frequently. Sometimes babies are diagnosed with having torticollis because they're turning their head to one side and not the other. And sometimes they've got the lean as well and the turn. And that is because there is involvement of the cranial nerve that controls the sternocleidomastoid muscle, or SCM. It's right there. It's a big muscle. See that right there? And it will create that action on one side. And guess what? That cranial nerve that controls that muscle comes off the brainstem. So if there is brainstem compression or upper cervical subluxation or restriction of the cranial sacrum movement, this can all affect head movement and therefore affect whether they're going to be able to do the asymmetric tonic neck reflex. So that is where I'm going with all of this. And sometimes if there is some spinal subluxations or cranial restrictions, it's going to affect that nerve pathway of the primitive reflexes of what the arm is doing, because that is a motor control from a spinal nerve, which has to come off the neck for the arms and the low back for the legs. So we want to make sure that there's no interference to the nervous system. As I said, if the baby is born by C-section, sometimes this primitive reflex is not activated, so it may not be present. And so this is something to just know. And if you can work on doing it by doing sort of the exercise with your baby. And if you want to know about that, you can contact me. I'm going to focus more on retained primitive reflexes, but this is definitely something that you can do to stimulate this reflex in your baby. All right, so let's go on to retained asymmetric tonic neck reflex. So when you watch the overview of primitive reflexes, you're going to know that although we are born with these primitive reflexes, they are supposed to integrate. So they're supposed to appear like they disappear, but what they really do is they integrate so that there's more top-down control of the brain, and then you have the postural reflexes kick in. They're more mature. But if this reflex does not integrate, it's going to be retained, and this can create problems for the child. So it should be integrated by 4 to 6 months. Beyond that, it means it is persistent. So you can do this with your child, and this is what I do to see if it is retained. So number one, you can have your child just stand still, stand right in front of you with their arms straight out and their eyes closed. So almost looking like Frankenstein. And then you just turn their head, and the arms should stay right where they are. They should not turn. But if they turn to the same side the head is turning, so, we've got Frankenstein arms out, turn the head, and they go along to the right side, or vice versa on the left, then that means that that reflex could be retained. And it can occur on one side or it can occur on both sides. So it doesn't matter if it's one or the other. And you can also check this by having your child go on their hands and knees, close their eyes, turn their head, and if this is retained, then the opposite elbow is going to bend. And it is quite obvious. Sometimes it bends a lot and their shoulders almost touching the ground, and sometimes it just bends a little. But this one is really obvious. Now, sometimes the arms that are out are going to migrate down. They get tired. That's another issue possibly with the brain. So if that occurs, that's another aspect, but it can also occur with this. And so this is what I do on the first visit in my office. I'm checking primitive reflexes to see if they are retained. But you can try this at home, and if they are retained, then you can give me a call, or you can reach out and find a chiropractor who is working with children with retained primitive reflexes. All right, so let's talk a little bit about this importance of the integration, because why does it matter so much if this primitive reflex stays present? Well, first of all, it's going to help with the development of the milestones, especially of crawling and walking. So it's going to, by this integrating in the steps of brain development, it will allow the child to crawl. Because if this reflex is retained, every time the child turns his head, one side is going to extend and the other is going to bend, and it's going to be very, very difficult to get up in that quadruped on hands and knees position. And then later on with walking, what's going to happen is that there's not going to be coordination between the top half and the bottom half, and the child's going to have trouble swinging their arms as they're walking. There can also be an issue with vision and with eye tracking and with the arms and legs crossing the midline. Because what happens is that when a child turns their head to that side, they're extending one side. So it's called homolateral movement, where it's tied to movement ahead is tied to movement of the arm and the leg. So every time a child goes and moves their head, they're going to be impelled to move their arm. And if they don't, if they will try to stop that from happening, it takes a lot of energy, and they're not going to put the energy into learning. So say they're at school and they're trying to do something and they're trying to bring their arm to the midline, but they want to turn their head to the other way. It's just not going to work. This is going to possibly create issues with things like reading as well, because the same thing, or writing, you have to look down at your paper, and let's just say you go, the board's over to the side and you go to look at the board. Well, you can't control your arm while you're trying to do the other thing. So this is pretty huge. It's also important for brain hemisphere development and communication. So it will help with differentiating between the right and the left sides. When this integrates, that is allowed to happen. Otherwise, you're not going to be able to move your arms and your legs independently. They're going to be tied together with this reflex. The other thing is the development of handedness or dominance. So typically around the age of 2, a child will pick a hand, pick a foot, an ear, an eye. And so typically it's the right side, because the left side of the brain has to do with fine motor control and what we consider, intelligence, that type of thing. The right side of the brain is controlling rhythm more often than not. So we just want a child to pick a side. If they end up being left-sided, that's fine. There's a whole thing that goes on with that. But just pick a side, any side. But if you don't have a child who develops handedness, this can create issues with brain development. In other words, starting off ambidextrous is not preferred. If you pick a side at age 2 to 3, and then later you start developing use with your other hand, that's a whole nother story. All right, so let's go right on into some of the indicators where you might think that your child is having an issue with a retained asymmetric tonic neck reflex. So there's a number of things here. It seems like a lot, but they're not going to be able to do that cross-pattern movement when they walk, run, skip, march. In other words, the opposite knee comes up, opposite arm comes out. It just cannot compute. Difficulty riding a bicycle. A lot of skills are involved in riding a bicycle. This is one of the best things you can have your child do, but they're going to have a difficult time. Their balance is going to be affected by the head turning. So this affects our vestibular system. When we turn our head, there's signals inside of our brain. And I talked about the vestibular system last week when I talked about the tonic labyrinthine reflex. You may want to just visit that because I did go into depth. But it is related to what's happening with the ears and the eyes. And so if you are having issues with this retained reflex, it's going to affect eyes, it's going to affect focus and that near-far coordination, and they're going to have trouble catching a ball or kicking a ball. Anything bringing their hand to the center is going to give them a problem. They are going to possibly have poor handwriting. They might be diagnosed with dyslexia if they are reversing letters and numbers. They might have learning issues with spelling, math, and language. Sensory input confusion from the eyes and ears, and this can create memory problems because of the sensory processing. If that's being affected, so the information comes into the brain, but then what do they do with that information? If they have trouble processing it, then how are they supposed to remember things? Scoliosis might be an issue. So I talked a little bit about torticollis, and that's where you have the neck that might be tilted to the side or turned to the side or both. And this is a spinal issue related to what's going on with the nervous system. Well, so is scoliosis, because if you have a certain pattern of movement, your muscles are going to end up being asymmetric, and that can then affect how your spine grows. The social and behavioral changes often occur with multiple retained primitive reflexes. Usually children don't just have one, but this one is very, very powerful, and along with the Moro, I would say, in the tonic labyrinth reflex, well, all of them, social and behavioral changes are quite common, or challenges, I should say, are quite common. And like I said, often your child's been given a label, ADHD or autism or dyslexia, because of the symptoms that are portrayed. But if we go back and look at this retained primitive reflex, if we integrate it, then you have a chance of a lot of these indicators and the symptoms to actually disappear. All right, so what do we do for remediation? One of the exercises I use is called Lizard, and we try and use cute little names for the kids so that they get into it. And it's that homolateral movement where you're moving on one side. So at the top row there, you can see that the little girl's head is turned to the right. She brings up the knee and the arm in sort of a lizard position at 90-degree angles. And then she turns her head, and then she's going to bring the arm and the leg down. So that's one half of a round. Then she brings the left side up, turns her head, then brings them down. So that's a full cycle. And I would have children do this 6 times or so. The slower the better. If they go too fast, they have to do it more. And you want to also hold certain positions for 5 to 10 seconds so that it gives the brain time to integrate. So this is one of the exercises that I do. And the other one is basically the fencer reflex exercise. So I've got sort of mirror twins of a fencer there, because this is what I would have a child do. They could be laying down, they could be sitting down, they could be standing even, but they're going to turn their head to the right, and they're going to extend their arm and leg at the same time. So it's going to be akin to, out and back in, and out and back in. And they're going to do it with their lower half too. So it's merely doing the fencer position repeatedly. Now, if you have your fencer reflex integrated, it's not so hard, but this is a very difficult move. And oftentimes I don't start off with this one. I start off with the lizard. And also they may need some help doing it. And then as far as the lizard goes, sometimes I will do variations too that make it more difficult using the opposite sides of the body. But these are some of the preliminary exercises that I do. All right, so you can find me at losangeles-chiropractor.com. I have a lot on my website. I've got all the links to my YouTube channels and podcast channels. As I said, this is my specialty. I've been in practice for over 30 years. I also am the mother of 3 now adult children. And I can do a lot remotely as well as in-office services. And if you don't live in my area, I can try to help you find somebody in your area. And in my office and remotely, I can help you with these primitive reflex evaluations and also the remediations. It's amazing what you can do with Zoom and Skype and all of those fun things. So, like I said, hopefully this has been useful information. Give me a thumbs up if you have found it useful. Don't forget to subscribe and hit that notification. And go ahead and contact me if you think I can be of any service. And I will put the link to my website in the description. All right, have a great week, and I will see you here next Tuesday, 6:30 Pacific time, like always, and I will be covering another primitive reflex, so you just have to wait and see what that is. All right, bye now.